right now, millions of people are looking for health care coverage, but the increasing cost, it's making it tough for people to make ends meet. The Tennessee Justice Organization says about 300,000 people might have to choose between next month's rent and their medicine. 10 News reporter Krissa Lucas shares how it's impacting thousands of East Tennesseans. Krissa?
Yes, Robin. The biggest issue here is thousands of people who are working full-time make too much money to get assistance for health care, but not enough to afford their own coverage, leaving them uninsured.
I was like, sir, that's all I could do. That's all I've done in my life.
Troy Young started working with his dad on commercial steam pipes when he was 14 years old. About 7 years ago, Young says the doctor told him to pause on physical jobs because of a health diagnosis. The 53-year-old doesn't qualify for Medicare or any governmental assistance.
I mean, it's sad, for all the years I worked and put into the system.
This is why he couldn't get medical even when he was working.
First time I went in, I think I was making like $60 too much to get insurance.
He repeatedly tried throughout the years to find affordable coverage.
The minimum wage went up. Then I was like, then you're going to tell me I ain't qualified because now the minimum wage is up.
Experts say when looking for coverage, it's critical to see how much you will pay.
Look at what that annual out-of-pocket cost is. Look at, do they have a lifetime max?
The Tennessee Justice Organization says in order to close this gap between affordability and access, the government would need to expand Medicaid to help people like Young.
Well, so the Medicaid expansion would give comprehensive health coverage to people who don't qualify for Medicaid or Medicare, but who don't earn enough or have employer-sponsored coverage.
Young's biggest fear for the future if he doesn't receive help is this.
One day I ain't going to be able to take care of myself.
There are options. The deadline to file for healthcare.gov insurance is next week on the 15th. If you do qualify for Medicare, the deadline to register so you're covered for 2023 is this Wednesday. Robin, back to you.
All right, Krissa, thank you very much. And looking